So a little bit about me. I used to work for Social Security Administration in their local field office in Atlanta, Georgia, for about 9.5 years after I got out of the Air Force. And I really, like just many of us never intended to be insurance agents. I never intended to go work for Social Security. I had a friend that said, just give me your resume. They're hiring disabled veterans. And I was like, well, what am I going to do at Social Security? That sounds like the most boring job ever, especially after working on fighter jets, and traveling the world. But they eventually called me a year later and I got hired. And I found out that Social Security did so much more than Social Security cards and death benefits and stuff like that. And I actually fell in love with serving the community. Like, I worked in one of the busiest offices in the country where people came in from all walks of life. People came in that were homeless, that needed help. I had people who were unfortunately living under the bridge. And I also had celebrities in Atlanta come in and everything. We had to learn how to treat everybody, with the most respect, regardless of their background and their situation. And, one of my skills became finding out more information so I could truly help them. Because sometimes people only give you a little bit, and there's really the change the more information I find out. And so I'm going to present some information to you so you can use Social Security knowledge to help your Medicare beneficiaries, your life insurance clients, and build your pipeline way before people turn 65. That's my goal. I try to get people in my pipeline as young as 60 because I want them to find me and be already in love with me. So when all the call centers call them and everything, they're like, I already have a girl, right? So let's go. We're going to cover a couple topics that I think everybody should know if they're going to talk about Social Security. You probably should know this, just to help your aging parents, your grandparents, if you're not of the age, or maybe you are of the age. A couple of my agents are over the age of 65, and they use these topics to help themselves. So I'd like to do a topic, instead of just doing Medicare 101s around the country, I prefer to do 10 things you should know about your retirement, or a Social Security workshop. I think it attracts a lot more people and it's a broader sense. And Facebook, actually, my ads come in lower. So that's a top secret tip there, Dustin. So things that I think a workshop should cover is I think you should teach them how to create a socialsecurity.gov account and analyze their earnings record. I like to host these at libraries where they have access to the computer. I like to talk about how filing information, timing, and entitlement on other person's records, how work affects benefits, earning limits before and after full retirement age, health insurance before age 65. I like to talk about the Medicare parts, A, B, C, D, and you can actually talk about supplements. I like to talk about employer benefits and at retirement, and we'll dive into that. I like to talk about how to file for Medicare. IRMA planning, this is one of my biggest that most people say, Joanna, I've gone to a bunch of Social Security and Medicare seminars and nobody's told me about this. I like to talk about other programs like extra help for Part D, Medicare Savings Program, and one of my specialties, Medicaid waivers. And I also like to really help self-employed people because that's a really big hurdle I've seen lately is self-employed people not having their ducks in a row. Go ahead and whip out your phones. I created a gift for you guys. You don't have to sit here and take screenshots of every slide or try to figure out where all these resources are. If you go ahead and enroll into this free course, don't worry, I'm not going to sell your information to anybody. All the documents that I used with my consumers and my clients, they're all in here. There's about 15 documents from Social Security and various other subjects that you can use. And this slideshow, after we're done, will be uploaded there for you to review. So if you go ahead and enroll into this, all the documents and everything's there, so you don't have to sit here and take pictures with your phone. I'm just going to give everybody a minute to grab this. So there's a lot of noise out there in the Social Security realm, Medicare realm of, I have to become an expert. I have to know everything. And I actually don't think that's true. Just like Medicare, you don't have to know everything to start helping people, right? Because I've seen plenty of agents get their PhDs in Medicare, for example, but knowledge without application is fruitless, right? So I put it together a bunch of questions that I think most consumers asked me over the last I've been working with Social Security since 2012. So since 2012, actually no, yeah, 2010. So 26 years. I'm sorry, 16 years. What they've asked me. So one of the first questions that agents ask me is, Joanna, why doesn't this person have Medicare? They said they've been getting disability for over 2 years. I know the rule is 2 years for someone to get Medicare with disability. And this is one of the most common confusions in Medicare enrollment. And the answer is going to change everything. So the first thing I think agents should understand, and it's probably a big secret, is that there's more than one program at Social Security Administration. They actually administer two programs, RSDI/SSDI versus SSI. So RSDI stands for Retirement Survivors Disability Insurance. SSI stands for Supplemental Security Insurance. RSDI/SSDI is something that we work and pay into. It's generated by those pesky taxes that come out of our paychecks. You have to work and earn into it, or your spouse did, or if you're a disabled adult child, your parent did. SSI is a needs-based program. It's essentially federal welfare for those who are disabled, uninsured or underinsured, or over the age of 65 and lower income. And so for RSDI, a child can get this. Many of you might know already from having Medicare eligibles, but a child can get this if they became disabled under the age of 22 and they have a parent who's entitled to benefits, currently drawing benefits. So for example, my little sister, she was disabled all her life and she's what we call a disabled adult child. The perfect storm happened for her. She turned 18 and my dad turned 62. Now, had she turned 18 and my dad was only 60, she would have had to wait until my dad turned 62. And the parent actually has to file for their own benefits before the child can claim on their record. So somebody who's, think about someone with a diagnosis of maybe Down syndrome, cerebral palsy, autism, or maybe an accident or illness that just happened before age 22. These are potentially eligible for people to claim on a parent's record when that parent does turn retirement age, or if that parent becomes disabled themselves. So oftentimes I see somebody who maybe have a lifetime illness, but their parent is really young. I've had 25-year-olds and their parent is only 45. Some states do have a state supplement like Michigan. So the question I always ask people is, hey, Dustin, what day do they get their check? Is it on the 1st, the 3rd, a Wednesday, or both? So if it's on the 1st, that tells me it's SSI and it comes with full Medicaid, right? And that's important to know if they have full Medicaid. If it's the 3rd or a Wednesday, it's RSDI or survivor's benefits or one of those entitlements, right? Now, if they have state involvement, such as Medicare Savings Program, it's going to come on the 3rd. If they have SSI and disabled adult childs or SSDI, it's going to come on the 1st and the 3rd. So they'll get those concurrently. For RSDI, you cannot get disability on a spouse's record except end-stage renal disease. We actually had a child of 2 years old on dialysis, and that child receives Medicare for ESRD on their parents' records because their parent is insured. But that's the only time you can receive disability ESRD entitlement on somebody else's record unless you're a disabled widow within 7 years of the spouse's passing. So this is the big tip. To first understand Social Security, you should understand how the program's right here. If you remember this and engrave it in your brain, this will say, okay, when someone says I've been getting Social Security for 10 years, but I don't have Medicare, I just have this Medicaid card, ask what day do you get your check? Because under the age of 65, if they're not insured, maybe they became disabled after they stopped working a long time ago, they're simply not insured for that. Somebody had 39 credits at the end of December and they already made $1,890 this past quarter. They can provide that paycheck stub to Social Security, showing that they now have 40 credits and become entitled. Or if someone is self-employed, I see this all the time where they're not doing their taxes appropriately and they might have missed filing and getting credit. So a lot of times people, when I worked at Social Security, they thought that they were getting over on Uncle Sam by not filing their taxes and working off the books, but they actually hurt themselves by not filing their taxes because they missed out on their retirement credits and their Medicare entitlement. So if someone is door dashing, having a yard sale, making cookies, babysitting, doing hair, wands, those are common self-employments, they can file their taxes and provide that to Social Security to get those credits updated. And then I think that to decipher their earnings record, everybody can log into their socialsecurity.gov account. And matter of fact, I think every agent should already have or create their socialsecurity.gov account. It's free to see your own earnings record and to understand what people see on there. It'll show you exactly how much you've made up to date. They update it every August for the current year. So 2025 income, when you file your taxes by this April, by August, the IRS will provide that to Social Security and you'll see it updated, sometimes even faster than that. But the questions that we're going to ask on the earnings record is this person insured for retirement? Do they have what they call a family max that can provide benefits for a spouse or a disabled child or even minor children, right? Because I have 65-year-olds that have children under the age of 18, they might be entitled to benefits. Should this person also file for disability? I just got a question in my inbox the other day of someone's spouse and they're 65 and a half years old. Their full retirement age is 67, but they have Parkinson's and they're really tired. The day you file, you become under this, you should file for disability if you have a condition that is going to prevent you from continuing to work or result in death. And you have to do it before your full retirement age because there is no such thing as getting disability and retirement. Disability is receiving your retirement as if you were already 67. So I told them as soon as he wants to work and is under that 1690, he should file like the next day. Like if he needs to go on FMLA or, sick leave, he should file the day he does that. Because time is of the essence, right? So the other question I get is if I retire before 65, I won't have any health insurance, so I have to wait. And a lot of us as agents, we know that's not true, but a lot of consumers don't know that there is marketplace.gov where they can get their own health insurance, and they don't know that there's massive subsidies. They don't know that their assets is not counted towards that. Like for example, usually someone who's making $2,000 a month on Social Security, maybe they're 63, 64, usually they qualify for almost a 94% subsidy. But people know that because they listen to the commercials about how expensive health insurance is. They don't know that there are subsidies out there or tax credits and how it affects them and what it looks like. So I like to use this to build my pipeline. I like to get help. I help those 62, 63, 64-year-olds get onto a marketplace plan, and then I age them into Medicare. But a lot of them don't know that until they come to one of your classes. So a lot of questions I ask is, do you have entitlement on a spouse's? Because retirement on your group coverage is a qualifying life event to go onto a spouse's plan. May you qualify for an ACA plan because assets is not a factor? COBRA is also a last ditch effort if someone missed an open enrollment or a special enrollment. And then just offering them benefits before their Medicare age. This is actually a point when someone is retiring, maybe at 62, where I'm going to talk about other options for them, and I'm going to talk about that in the end. So unlike a lot of Social Security analysts out there, I don't think that most people come to me and ask me exactly how much they're going to make because they could see in their Social Security portal because their income is their income. It's different than their spouses. It's different than their next door neighbors, their siblings, their parents. But there is a formula here. So at the age of 62, you're going to file, you're going to file an early retirement. 62 is the earliest you can file unless you're a widow. You can file at 60 for a widow's benefits. But you take a permanent reduction when you file. So whatever age you file at, you're taking a permanent reduction. It does not go up by age. It does go up though if you continue to work and earn Social Security income, but it only goes up like a fraction. Like if you made another $20,000 this year, it's probably not going to move the needle a whole lot for you. Now, some people advise of this, but there's people who should not delay until age 70. Because there's what we call the missed opportunity that a lot of people miss. So one of my best friends, his name is Zach, his dad delayed until age 70. His spouse was not insured on her own record. So there was a missed opportunity for both of them to get checks. And then unfortunately, he passed away at age 70 before he could even file. So had he talked to me, I would have talked to him and be like, listen, the money you're giving up, you're not going to break even until maybe 82. Even beyond that, it's probably going to be even more years if there's a spouse that is missing entitlement on their own record. And they were not rich. They didn't have, Donald Trump money or anything like that. They were really living penny by penny. And so in my opinion, if I was their advisor, I would have said, hey, you're missing this here. You're not really going to break even until you're later in age, 83, 84, probably. And do you need your money now, or do you need it do you think you're going to live until you're 84? And unfortunately, I don't have a crystal ball for everybody. I could just show you the math. And then my parents were like, Joe, I don't know if I'm going to live until I'm 84. Mommy and daddy passed at 65. One of my grandparents she's still at 95, but my other grandparents, they passed away when I was a baby in 1982. Right. So we don't know. So it's the best guess math. Right. And so there's really no size fits all. I think when people give general advice, they really could hurt some other people. So I show people this and help them navigate. Like my mom making under the earnings cap. And I said, Mom, you can still work and make your $10 an hour and still get all of your checks at 62 and increase the quality of your life, because she was making 18,000 a year. I said, Mom, get both. We don't know your health, but you could use your money now versus at 85, right? So that was the perfect situation for my mom. The other questions I get asked all the time is, especially with teachers, firefighters, police officers, is my client worked for the city for their whole career, 30 years, and they only had 28 Social Security credits. Can they even get Medicare? And this question comes up a lot because there's actually two different filings. Social Security retirement benefits is completely different than Medicare entitlement. There's two taxes that come out of your paycheck, one for Social Security and one for Medicare. So when you log into your earnings record, you're going to see two columns, one for Social Security and one for Medicare. If someone works and pays into a pension that does not contribute to Social Security, it'll show a 0 in that Social Security column, but it'll show the number that they paid in for their Medicare taxes. So most of the time, I've rarely seen anybody who was not Medicare eligible that had a government job ever since like 1982. The only exception is like clergy members who, accepted out of it. But for government workers, most cities, teachers, they usually have Medicare credits. I have yet to see somebody who doesn't have Medicare entitlement. So the answer is yes, you could help them compare their teacher's retirement plan to an individual Medicare plan. Back in Atlanta, the teacher's retirement plan was not better than a Medicare supplement. They were paying hundreds of dollars for, essentially an HMO. And I was like, man, let me show you what a med sup could do for you, right? So this is really good knowledge to have, especially if you're working in the teacher's market or the public sector, is to know how to read the statements. And this is what I was talking about. So it's called Medicare Qualified Government Employment, MQGE. Here's the policy right here. Very few other people know about this. So this will give you the top ratings, because most Medicare agents, they don't know what this is called. So these are the questions to ask is ask either the last stub. It'll show the Medicare taxes on that. Most people who are still working would have it. They usually get paid every couple weeks, right? Another question that I get all the time from agents is, my client called me furious. SSA is taking money out of their check. Why are they doing that? She's 63. She still works part-time. Is this a mistake? And it's not a mistake. There is an earnings test for taking early retirement. The money's not lost forever, but they are not entitled to it. So if someone is withholding money, if Social Security is withholding money because someone is making over the early retirement, they're not going to get it back in the future. Like they're not going to get that money that's held this year, next year. They're going to get, no, it's because you were working and you didn't do a work report. Now, if you stopped working, you have to tell Social Security so they can adjust that work report. But they're going to assume that you're still making what you made on your work report. It's going to be minimally reduced, but you'll get that Social Security check to make some breathing room for the day you retire. And a lot of times they use that to pay off some bills, maybe pay off a car payment and stuff like that, or just to like catch up and have some savings for the day they, retire and they to go from making 5,000 to like a $2,000 check because it's usually a big disparity when people go from making, 60,000 to 24,000, right? And then after full retirement age, after 67, you can make millions of dollars. You can make Donald Trump money. Social Security doesn't care as far as your retirement check goes. They do care as far as your Medicare goes. So the Medicare parts you could teach during a Social Security workshop or retirement planning is you could teach the generics of the A, B, C, D's, med sups. You just can't show plans. You can't, talk about the AARPs of the world. You can't talk about how amazing, particular HMO, C-SNP, D-SNP is. You talk about this is a big thing that I see overlooked all the time. And I don't see many people asking it is you see right here, Dustin, it skips. It goes from if you make over 109,000 married filing separately, it skips all these brackets and all the way to almost the end. And if you're married filing separately, you're paying this if you're making over 109. So one of the questions I ask people is, what is your filing status? Are you married filing jointly, married filing separately, single? Because that could be a big factor on why they receive a crazy bill and if they should even be filing for Medicare if maybe they have access to, a group plan through their spouse or themselves, right? A lot of accountants don't understand how the married filing affects the Medicare premiums. And it might be for something like student loans or whatever reason that their accountant said that they should file married filing separately. But I challenge them. I said, take this premium to your accountant and see if the reason that they're having you file is less than the cost of the Medicare surcharge on the IRMA. And oftentimes it's probably not. It depends on the legal situation on why they're doing it. I'm not a CPA. I don't practice taxes, but I just have to arm them with the information is this worth it to continue to file married filing separately, knowing that you're going to pay an increase in IRMA? And a lot of times people are thankful, and this is why you want them to come see you before they turn 65, because at 65, I can't fix how you filed at 63. I can't fix how you filed at 64. I really want you to get this information at least by 63 so you can fix how you're filing if you need to, right? So this is one of the main reasons I need people to learn this before they hit that age and make filing mistakes. So this slide shows a package and everything. But I don't find that many CPAs are telling them about how this married filing separately affects other programs. One of the questions I get all the time is my client just retired in the middle of the year. Their income dropped by $80,000, but Medicare still charging them the IRMA based on 2 years ago. What should we do? And oftentimes I see agents say you should appeal it. And it's not actually an appeal if it's a life change event. An appeal for Social Security means the facts are wrong. So if someone got an IRMA notice that said that they made $1 million last year, but they didn't, maybe somebody stole their identity, maybe it was, a dot misplaced or something, that's an appeal when the facts are wrong. If IRS says, hey, Joanna, you made $1 million last year, but I had 600,000 in expenses, that the facts are wrong. The qualifying events are marriage, divorce, death of a spouse, work stoppage. This is one of the most popular: work stoppage, work reduction. These are the most popular two. Loss of income producing property, not just selling your second house on the beach. Okay, I can't fix that. Loss of a pension income, and employer settlement payments. So like if someone gets like a severance pay, that could also be that. So there's a form to file. It's called the SSA 44, and they simply submit this to Social Security. I would not snail mail this. I would either deliver it in hand or send it with tracking and proof of signature delivery, because it's that important, with a copy of the proof. So you need to prove that whatever happened happened. So you need to do work stoppage by maybe a separation letter from your employer, a divorce or annulment documentation, marriage documentation, whatever the is, you have to give it supporting documents. And then Social Security will use the new year, the new income that you're making. So if I was, let's say a doctor and I stopped practicing and I'm only going to take out funds from my 401k, that's a work stoppage. And even though I have income in my bank account, they don't care about assets, they care about earned income, not assets. So this would be a reason to file. I see this all the time where people don't know that they can do a life change event. So they're paying IRMA for years beyond, not knowing that they could have saved that. And it doesn't really get refunded unless they can usually back it a couple months. But if you pay 2 years of IRMA because you didn't know, you're just giving them free money. You can apply for Medicare only online. This is one of the other questions I get all the time is, Joanna, I'm turning 65. I think I have to apply for Medicare and my Social Security at the same time. And I say you can apply for Medicare only, and you can actually only apply for Medicare Part A only if you wanted to. If you don't need Part B because you're entitled to group insurance on a spouse's record through their active and active employment, not employment. I see that all the time too, is someone's like, well, I have retiree coverage with, the teacher's retirement. I'm like, that is not active work insurance. It's not going to avoid the special enrollment penalty if you choose to get Medicare Part B later. Same thing with FEBA. I said, if someone has federal eligibility on the government, just because they worked for the government and have work insurance through a retirement plan doesn't mean that they can, plan to take Part B later without a penalty. Unless it's active work, there is going to be a 10% penalty, even veterans. And I'm trying to fight that with Congress, but veterans, if they don't take their Part B, when they should, they are going to have that Part B penalty later. And people need to know what that Part B late enrollment penalty is, because the only way to get rid of the Part B late enrollment penalty is if someone qualifies for Medicare Savings Program, then the state actually pays for it. But when they lose it, it's still there. It doesn't ever go away unless someone proves that they had through their employment. But these are the steps. It's really easy to apply. It's less than 10 minutes on socialsecurity.gov. And this is what I just offered to help people with. A couple of my offices, they have, standalone computers for people to use if they don't have their own for the consumer to apply. Now, Dustin and I were talking at one of our conferences about benefits that people miss because a lot of insurance agents, I feel, Dustin, classify themselves as a Medicare agent. So if I tell you, hey, Dustin, I'm a Medicare agent, you're not going to think that I can help you with anything but Medicare, but I'm not a Medicare agent. My licenses are life and health and allows me to do a broad range of assistance for you. So when people are leaving an employer, 65, 66, 67, 70, they usually need some assistance with other insurance products that we can help them with. The number one reason people tell me that they don't own their own individual life insurance policy is because they have it at work. Well, guess what's happening? They're losing it. The moment they retire, poof, that work insurance disappears, right? Life insurance is never cheaper than the day that they're meeting you. So you can actually help them get life insurance before they go to retire, because they're not going to get any healthier. It's not going to get any cheaper because they don't get any younger. So if someone sees you at the age of 60, I would always encourage them to do the life insurance now versus wait until 67, because there's going to be a massive price difference. They could have a stroke between now and then. We don't know. I don't have a crystal ball, right? Dental and vision. Usually a employer plan offers the most robust dental and vision pricing, right? But people still need help as they get older. They still need help with their dental and their vision, and these are benefits we can add on. And then prescription coverage. A lot of them are taking fancy prescriptions nowadays because commercial coverage gives them so many robust pricings. And I might need to even help them find some assistance. Like if they're taking a very expensive prescription, I might be able to find them some manufacturer assistance. And then always discussing their retirement. Do they have a 401 or a pension that they need to help, with asset protection? Distribution affects the timing and their IRMA. A lot of people don't even think about this. Long-term care. Do they need to talk about long-term care? Is there hybrid options? Short-term care is my new favorite for people who can't afford long-term care or missed the boat on it, because short-term home health care like Heartland, that's one of our favorite products to sell because of the prescription reimbursement. And many people get their prescription reimbursement to cover a large portion of the premium. It's a no-brainer. And I can sell that policy as young as 40. And I'm actually selling it to myself because I need help. Like I live alone. I'm 43 and I had to fly my sister in from New York to help me when I had a surgery last time. So this is a good product. You can sell it to anybody. They don't have to be like, if they have their Medicare somewhere else, you could still sell them other products. And I think a lot of agents miss that. They're like, oh man, they're in the right Medicare plan I would have put them in. Okay, well, what else? What else can you help them? There's some plans that give GI windows and hospital indemnity windows for 65, and maybe they should have one of those along with their, current plan, especially if they have a large deductible on their employer plan. I think a lot of us miss the ship when they say, oh man, they don't turn 65 until next year, or they're 65, but they're still working until 67. So I didn't get any sales. I'm like, did you ask them about the rest of their life? Right. And so this is what I like to dive deep in. And I always ask their income, but I learned that Social Security, especially as I administered a welfare program, people get very defensive on like, why are you being so nosy? So I preface it with why I'm asking the questions, because I need to know in order to best guide them. So I usually would say, hey, Dustin, I'm going to ask you some questions about your income and assets and resources to see if you qualify or are affected by any federal, state, manufacturer, or local program. Is that okay with you? And people are usually like agreeable. They'll be like, oh, yeah, sure, I'll answer your questions. But if I just say, hey, Dustin, did you make over $109,000 last year? Dustin be like, why do you need to know how much I made? Right? And so telling somebody why you're asking usually alleviates the defensive mechanism that we all have. And it'll also prevent somebody from overinflating their income or, saying that they didn't make that much when they might have. Because they might feel embarrassed. So I need to know, is IRMA going to be a trigger factor? And maybe we need to apply a life change to reduce it. I need to know if you might qualify for extra help for Part D on this Mounjaro that you're taking, because that might change my analysis on which prescription plan or Advantage plan you select. I need to know if you're going to qualify for Medicare Savings Program, because if you qualify for QMB, I can't sell you a Medicare supplement, right? I also need to know if that you might qualify for SSI agent. Now, I didn't discuss this in the beginning. I'll discuss it now for you guys. SSI that I was discussing in the beginning normally has a disability requirement where they have to be disabled and under the income and asset resources. At the age of 65, the day before they turn 65, that disability requirement goes away. So I'm going to use a personal experience with this. My mom worked her entire life at a nursing home, taking care of elderly people as a CNA, but we don't pay a lot of our workers the best. And my mom has her 40 work credits, but her Social Security was really low. It was $700. And I said, Mom, I got her Medicare savings program the month before, right? Because she turned 65 February 25th, by the way, if you want to send my mom a present. So I got her Medicare savings program to start February 1st to pay that premium. But the day before she turned 65, February 24th, I said, Mom, walk into your local Social Security office in upstate New York and tell them you want to file for this program. They're going to be nosy and ask you a bunch of income and asset questions, but I think you're going to qualify for them to give you a raise on the SSI. So my mom, she got $700 a month on her retirement, and then she got an extra $294 a month on SSI. Plus, she lives in New York, who has a small state supplement. She got that extra money. So she got an extra check, right? That $294, I mean, that's substantial for her. And it came with full Medicaid that moves with her from state to state, unlike applying with each state. So my mom has what they call FBDE. And if my mom moves from, like, say, New York to Texas, maybe my mom comes to stay with me for a couple months during the summer in Texas. We just changed her address with Social Security, and her Medicaid comes with her to Texas. We don't have to wait for Texas um, state Medicaid to process it through the Medicare Savings Program. But this, it's like one of the top secret programs at Social Security, but it's actually one of the programs that Social Security prioritizes. So that when I worked at Social Security, there was my top priorities were people who were terminally ill, and then SSI age benefits. Like I had to take a whole chart. When people follow up on applying for benefits, I always tell them to check their Social Security portal 1 week later. They probably haven't gotten their letter in the mail yet. I can't control the post office system, but if you go into SSI.gov and go to print and benefit letter, it should show your Medicare ID number with the Part A and B there if it's been processed. If it doesn't show in your benefit letter, it has not been processed because it's like an automated system. If someone's applied for their Medicare and they haven't, like if they did a phone application or applied online and it hasn't been processed, I say give it 2 weeks and then call the local office. Call in first thing in the morning is always best when you deal with the government. Unfortunately, Dustin, when I worked for the government, people are not nice. They called already screaming before I could even get a hello out, and I wasn't the one who hurt them. And it's really hard to help somebody when they're screaming, you know? So call nice and make sure that you are tell your consumers to be very nice. You get more bees with honey is what I tell people. But people are there to help you, but they can't help you if you're, aggressive, right? And then let them know that their card is going to come separately. And that's where you can help them is you probably need that Medicare number to finish their enrollment into their Medicare Advantage supplement and prescription plan. Now, like I said, be exceptionally nice to people. Just like when someone calls you, do you want to help someone who's calling and cursing you out because they made a mistake and didn't pay their Part B premium? No. Like you're not going to go out of your way if somebody's calling you names and threatening to key your car, but that's what people do. So I tell them, be very nice, understand and listen, document the person's phone name and the phone number you called, the date and time, and actually listen to the instructions given. Because a lot of times when I worked at Social Security, I would give people specific instructions and then they would come back with part of the instructions or say that I told them something else. I was like, that's not what we would have told you ever, right? So make sure that you tell your customers to listen very carefully, especially if they need to provide specific documents, like a marriage record or a divorce record or citizenship records. Like those are the big ones that Social Security can't process benefits without the actual records. And when you mail stuff to Social Security, if you have to mail it, always send it certified mail. Never send it without it tracking. So you want to know when it's received and who signed for it, especially if it's an original document that you need to get mailed back. And make sure you put your Social Security number on the document. I can't tell you how many times people would send me documents with just their name and address, and there was no Social Security system where I could look up someone with a name and address. So it just I had like this big stack on my desk of documents that I had no idea who they went to. And I would just hopefully wait that they called or came in and said that they mailed something. And I would be like, oh, wait a minute. You mean this document here that you didn't tell me your name, date of birth, and social on? Because they need at least your name and date of birth to try to search for you. But there are actually people with the same names and dates of birth in this country. So it doesn't really narrow it down. I always say call first thing in the morning when someone's just getting to the office and they have their coffee before they've been cursed at all day. And if this doesn't do it, if somebody's still not processing documents, ask to speak to the office supervisor or the technical expert is the name of somebody who could help process documents for retirement survivors disability insurance and Medicare entitlement. And if that doesn't work, sometimes we have to get our local congressman involved, especially if someone's been waiting for their benefits to be turned on for more than 90 days and they've provided all the documents. At that point, I'm like, okay, this office is being negligent. You need to involve your congressman. When I received a congressional, it was the only thing we had to do that day. Like my manager would come over and be like, Joanna, this just came in from the office. I need you to stop what you're doing. I'm going to reroute your appointments to somebody else. I need you to focus on this right now. And like that's all they cared about because they were in hot water. They had to respond. Normally, offices have 7 days to respond to a Congress office about what the problem is, and they have to try to resolve it. So sometimes we do have to get our Congress offices involved because they're there to serve us, right? And that's always like a last effort. Like try to work with local management and everything. But if someone's stonewalling you saying, oh, this person's on vacation, your documents are sitting on their desk, no, I need to see somebody else. Like I'm not going to wait for someone to get back on from FMLA. That's crazy. It's crazy talk. And then I own one of the best Medicare Facebook groups in the country. It's been active since December 31st, 2017. I became a part of it in 2018 when my former mentor, Judge Atola, found me as a lost little agent looking for help. And then I took it over. Medicare Mentors Media, there are copycats out there who are stealing my name. And so make sure that you're on the real deal and I'm the admin of the group because some folks stealing my name. And I did trademark it back in 2018 because I never knew about trademarks. So if you have a cool name, make sure you trademark it. That's my other free piece of advice, okay? But yeah, I would love to engage with you guys. If you have questions, you can post that to the Facebook group. My Facebook group is usually one of the only ones qualified to answer in-depth Social Security questions. Yeah, it's my pleasure. My pleasure. Now, do we know how to let me figure out if I can allow people to speak. Oh, let's have questions in the chat. Oh, the pointer's covering the slide. Which slide, Susan? Was it the other one? Let me go back. Hold on. I have dual monitors over here. And the documents to support this are already there. So if you log into that course, it's just going to show you the documents right now. I will try to get that spreadsheet, Tom. I have to see how many of them are still active. They might have figured out that I shared the phone numbers and changed them. I have to get that spreadsheet. Is this the one, Susan? I still haven't figured out how to let people talk. If you have a question, you could raise your hand, and then that'll let you talk. I just figured that out. All right. No questions. That's the first for everything. I'll be there in July in Utah. Thank you guys so much for coming. If you don't have any other questions, I will see you around. You can join the Facebook group. Make sure it's the real Facebook group. And I will upload this into this course. Giving me until Friday. My staff will have it uploaded. You're welcome. Bye-bye, guys.
Thanks so much for tuning in. If today helped even one person understand their top flight insurance better, then we did our job. See you next time. And remember, we're always in your corner. Take care.